Hi there, my name is Dr. Tiffany Jones. I'm a senior clinical pharmacist with PacificSource Health Plans. We've been receiving a lot of questions about drug shortages from our community members, our providers, and our employees. I wanted to go ahead and answer a few of those questions for you now, and I hope that this helps. So first off, what are drug shortages? In short, they're basically when there's not enough drug product in the market to meet the demand that we have. So, what are some common causes of drug shortages? So, the most common causes, there's two different kinds. When it's a brand manufacturer, there's typically only one maker. And anytime they experience any difficulties at their facilities, it could be from wildfires, it could be from ice storms, or it could be difficulties with their manufacturing equipment. When they experience those difficulties, it delays their ability to put out their product and can lead to shortages. When it's generic manufacturers, although there are multiple manufacturers, sometimes there's shortages in the active ingredient that's needed to make the drug, or there's more than one company that is making the drug, and it's hard to predict demand versus how much any individual company is making. All of these factors come together to make it so that there's not enough product on the market to meet the current demand for the drug itself. So the next question is, what can we do about drug shortages? In short, there's not much we can do on the individual level about drug shortages, but being aware that they exist can make all the difference, and it helps us be proactive about our care. So although we may feel that we would like to purchase more than we would need, this excessive purchasing can actually create shortages and prolong them. When people hear that a drug may possibly become on shortage at any point in time. And so we definitely discourage that. And knowing that for most products, there is an alternative on the market. Your local pharmacists and your providers can definitely help you with the alternatives. One of the biggest shortages that we're seeing right now that is impacting the largest amount of people is the amoxicillin shortage. Amoxicillin is a really common antibiotic that we use for a variety of conditions, whether it's pneumonia or whether it's an ear infection in children. And so this shortage has impacted a lot of people. And so the biggest question we have is, what should I do if I get sick this winter? So the big thing to know is the amoxicillin shortage is currently only impacting the suspension. So there are chewable tablets available as well as capsules. There are also alternatives. The alternatives are, for example, the longer acting form called amoxicillin clavulanate or Augmentin. We have cephalexin suspension and Bactrim suspension. So knowing that that's in shortage when you go and see your provider can be really helpful and can shorten the time between being diagnosed and treatment. So another common question that we have is my doctor not prescribing me an antibiotic because of the shortage? And honestly, no, we haven't seen any changes in the volume of prescriptions being written due to shortage. So typically, it's good to level set our expectations of our providers. Although we would love there to be a quick fix for a lot of the ailments of the season, including the common cold, the flu, and sore throat, antibiotics are not the answer to these, as they are typically viral in nature and self-limiting. So we definitely encourage the tried and true methods, which are going to be hand washing, rest, and symptomatic treatment with over-the-counter medications like acetaminophen and ibuprofen, but antibiotics are typically not helpful. So knowing that before going is also really helpful, that every visit may not result in a prescription for an antibiotic. So another question that we have that comes up often is, I have some antibiotic at home left over from a previous illness. Can I just take that? We highly discourage that, simply because Not only can there be consequences from taking any expired medications, but also every illness is different and every antibiotic is not the same. So by taking antibiotics that are not tailored to the specific bug or the specific condition that you have, it's contributing to the resistance that we see in the community. And resistance is just when the bugs that are circulating in the community stop responding to the antibiotics we have because we're not targeting them with specific enough medications. So I really hope that this information helps you know what to expect in the event you become ill this season. And we highly, highly recommend, if you have any questions, you reach out to your provider, and I know that they would be glad to help you. You can also reach out to any of our healthcare professionals that are ready to answer any of your questions here at PacificSource. And so once again, my name is Dr. Tiffany Jones, and I hope this is helpful. Please share this with anybody that you think could benefit from it. And I hope you have a wonderful winter season.